Assalamu alaikum. Hello friends, welcome to nursing school. My today's topic is intravenous cannulation. Let's start. Introduction. Intravenous cannulation is the second most invasive procedure for patients in hospital. Today, 85 to 95% of all hospitalized patients needed intravenous cannulation. Definition. Intravenous cannulation is process by which a small plastic tube is inserted into a bevel vein. Purpose. Repeated blood sampling, intravenous fluid administration, intravenous medications administration, intravenous chemotherapy administration, intravenous nutritional support, intravenous blood or blood products administration. Size of cannula: 14G color orange, 16G gray, 18G green, 20G pink, 22G blue, 24G yellow. Parts of an IV cannula: flashback chamber, needle grip, bulb, needle, catheter, catheter wing, bushing, lower lock plug, lower connector, injection port cap. Equipment: tray with tray cover, non-sterile gloves, alcohol wipes or gauze swab or cotton with alcohol, tourniquet, IV cannula appropriate size, adhesive tape, IV administration set, saline flush and sterile syringe or fluid to be administered, Sharps bin or Sharps container or safety box. Procedure steps. Step 1. Introduce yourself to the patient and clarify the patient's identity. Step 2. Explain the procedure to the patient and collect all equipment. Step 3. Sterile your hands using alcohol cleaner. Step 4. Position the arms so that it is comfortable for the patient and identify a vein. Step 5. Apply the tourniquet and recheck the vein. Step 6. Put on your gloves and clean the patient's skin. Step 7. Remove the cannula from its packing and remove the needle cover, ensuring not to be touch the needle. Step 8. Stretch the skin distally and inform the patient that they should expect a sharp scratch. Step 9. Insert the needle, level upward at 30 degrees. Advance the needle until a flashback of blood is seen in the hub at the cannula. Step 10. Once the flashback of blood is seen, progress the entire cannula a further 2 mm, then fix the needle advancing the rest of the cannula into the vein. Step 11. Release the tourniquet, apply pressure to the vein at the tip of the cannula and remove the needle fully. Remove the cap from the needle and put this on the end of cannula. Step 12. Carefully diffuse the needle into the sharp bin. Step 13. Apply the dressing to the cannula to fix in place and ensure that the date sticker has been completed and applied. Step 14. Fill a syringe with saline and flush it through the cannula to check for patency. If there is any resistance, or if it causes any pain, or you notice any localized tissue swelling, immediately stop flushing, trim up the cannula and start again. Step 15. Dispose of your gloves and equipment in the clinical waste bin. Ensure the patient is comfortable and thank them. Aftercare of IV cannula. Instruct the patient to inform the nursing staff if cannula site becomes painful, red, hot, or swollen. The area around the cannula feels wet or the dressing is coming loose. Thanks the patient and leave the patient bedside. Ideally, the cannula should be checked and flushed 3 times a day and should be removed after 72 hours. The most common sites for IV cannulation: hands, dorsal arc veins; wrist, volar aspect, cephalic vein, basilic vein, cubital median vein; foot, dorsal arc. Indications: administration of anesthesia, administration of fluids, administration of medications, administration of blood or blood products, radiological imaging using IV contrast, contraindication, sites close to infection, veins of fractured limbs, where there is an AV fistula present, edema, affected site of CVA, site of mastectomy, need for precise control of fluid balance. Complication: local complication, thrombosis, thrombophlebitis, phlebitis, infiltration, bruising, hematoma. Systemic complication: septicemia, fluid overload and pulmonary edema, air embolism, catheter embolism, speed shock. If you like this video, share the video and subscribe my channel. Thanks for watching. Allah Hafiz.